we had a fantastic day today, hearing to experts of all backgrounds, practitioners, consultants, professors, researchers, and what so. So now we welcome the top heavy two presentations coming up. So Mr. Ravi, if you are available, please share your presentation so that you can introduce yourself. Ravi Kumar is very experienced in supply chain, in pharma supply chain, especially what I know. Okay, of course, he is experienced in multiple supply chain companies like Gati. I remember I see your posts. So you spend a lot of time in supply chain industry, learning and solving complex problems, Mr. Ravi Kumar. So please introduce yourself, and then you can also talk about your company and what you do, and then please do the need. Thank you.
Thank you, Mr. Kader. I hope I can call you as Abdul Kader or Kader.
Yeah, you can call Abdul. Ek.
Yeah. Thank you. Thank you for setting up this first webinar. I suppose you're doing this first webinar on this topic online, and I see that there is quite a lot of growing interest in terms of moving the conferences and presentations to online mode, particularly when people are in different parts of the world, and then they can join and share their thoughts from the comfort of their houses. So thanks a lot for setting up this and then giving me an opportunity to speak. So my name is Ravi Kumar. A very brief introduction, as Mr. Kader already mentioned. I've been there in supply chain for about 22 years, spread across industries like retail, 3PL, and pharmaceuticals, in fact, predominantly in pharmaceuticals. When Mr. Abdul Kader approached me for this webinar and shared some of his thoughts in terms of the presentations and ideas, what people would be presenting in this summit, then I saw that many topics which were already covered, already there in the agenda, particularly in terms of supply chain best practices, efficiency improvement, AI. My predecessor already spoke about it in long detail. I came with the thought that why not we talk about something on cold chain, and it is not directly related to supply chain, but it is more in terms of logistics and global logistics, where cold chain is one of the very key important topic which has been talked about, particularly given that we have global warming and sustainability, which are actually the buzzwords today. And pharmaceuticals definitely is the industry which gets impacted directly to all these factors. So when we are talking about cold chain in pharmaceuticals, obviously it is not a very direct and an easy topic. It is mostly controllable within the organization, within the warehouses where we store the pharmaceutical products. But it becomes very challenging, particularly when the product is out of the facility, out of the manufacturing facility, and then it needs to be transported across multiple regions, multiple time zones, multiple modes of operation. And hence I chose the topic of relevance of qualified packaging systems in pharmaceutical industry today, to give a broad perspective in terms of what are the different kind of packaging, what are the challenges, what normally we face in terms of choosing the right packaging systems, and then why this is so important. And it covers predominantly some kind of practical situations as well, which we need to consider while we choose the right packaging systems. So I will quickly introduce what is the importance of temperature control in pharma, how the packaging systems have evolved over the period of the years, and what are the factors we considered for choosing choosing the right type of packaging for the products which we need to ship. I think uh, given the short duration what we have, I will try to justify the time and the topic. And at the end of the topic, in case if you have any questions, doubts, please let me know. I'll be very happy to answer. Of course, apart from distribution, logistics, central planning, and S&OP management in pharmaceutical companies, uh, cold chain was one of the very important topic which was close to my mind and heart, and I've been part of many projects within the organization to develop lane risk assessments, to develop packaging systems which can help us on day-to-day basis. So broadly, this is one statistic which came to my notice recently, and then I was really shocked that the 70% of world's top selling pharmaceuticals require strict temperature control supply chain. In fact, when we talk about pharmaceutical products, most of you know that there are solid orals, which are tablets and capsules, then you have injectables, then you have vaccines. These come in different packaging formats. And particularly if you look at solid orals and capsules, tablets are more resistant to temperature variations. But when it comes to vaccines and injections, they are more susceptible. And the potency of these products is also dependent on the external environment. Most of the vaccines and injections are temperature controlled predominantly within 2 to 8 temperatures, and they are also susceptible to exposure to light. So it is important that we understand what is the requirement of a particular product based on the stability data available, and then prepare ourselves with regard to the packaging and as well as the logistic solutions for transporting them safely. One of the key driver which is coming into the forefront these days particularly is uh, you know we have a lot of old molecules like paracetamols, diclofenac, or aspirin. These are molecules which are much more simpler in terms of their structure. And also these molecules are pretty old, and hence we know the right behavior of these molecules in terms of the temperature exposures or in terms of their stability performance, etc., over the period of the years. But now we are getting into an age where we are seeing more complex molecules, particularly in biotechnology, biosimilars, where these molecules are pretty new. We don't have the stability data, and we also don't know how these molecules are going to behave in practical conditions, practical situations outside the laboratory. So I think that is also one of the reasons which is driving the need for us to look at more controlled packaging systems, more controlled environments, how we can replicate or get closer to the lab conditions when we are shipping these products across the globe. So another few industry numbers what we also got recently is about 25% of the vaccines reach their destination degraded, particularly because they are not being shipped in the right conditions. They are not being maintained in terms of the temperature requirement what they have. About 30% of the products are getting scrapped because of these reasons. And about 20% of the temperature sensitive products are damaged during transportation only because there has been a breakage of the cold chain during the transit. And very simple example, if you look at when we ship temperature controlled products through by air transport or air freight, they have to go through multiple transit points, and one of them, which is at the airport tarmac. And in any given sunny day, the temperatures on the tarmac can go up to about 55 to 60 degrees, and whereas the predominantly the requirement of the temperatures of these pharma products are between 15 to 25 degrees or 2 to 8 degrees, and that is one of the major challenge which every logistics company, every 3PL and a freight forwarder faces these days, that how do they secure the product from these high temperatures on the tarmac, even though they are for half an hour to 1 hour short durations, but within that exposure, the products can go or spoil the potency of the product. And after that, even though we bring it back to the required temperature conditions in the storage area, it will not be really good to recover the potency of the product. And that's the reason packaging of the pharmaceutical products play a very, very important role in terms of how we transport the products. What are the challenges or what are the risks what we are facing in terms of the cold chain failure, particularly in terms of the medicines? The patient could be administered an unsafe product. A lack of compliance of global regulatory and standards-based requirements can increase liability, particularly when we are talking about regulatory requirements and compliances. It is very difficult, particularly when we have a wrong product or an unsafe product being administered. The liabilities onto the pharma companies and the logistics companies could be multifold. Thermal variability can lead to inconsistency of the results between the batches of the products. Obviously, that when you have different temperature conditions which are being exposed to a similar product, it behaves differently. The shipment can be rejected by the quality department, when they realize that there have been temperature excursions or, during the transit or storage. Obviously, the batch will be kept on hold, and then some samples will be withdrawn, and then they will be sent for testing once again before they are released for the patient use. So I think there are multiple challenges. In many of the conferences, I keep saying that pharma products are not like cold drinks. The cold drinks, generally we see it on the road. They are transported in open trucks, and then they get exposed to external environment like 40 and 45 degrees. But when a consumer goes to buy a cold drink, it is kept in a nice refrigerator in a nice retail store, where you don't know or you don't even realize that these cold drinks have been transported through about 40 degrees temperature or 50 degrees temperature before they have ended up in the retail store. But pharma products or injectables or vaccines are not like that. We have seen the relevance of vaccines being transported across the globe in cold chain during the COVID time. In fact, that was the time when most of the people realized how important cold chain is for transporting injectables and vaccines. And once there is a cold chain broken during the transportation of these products, even though you bring it, you keep the products back into the required temperature conditions, it will not regain the potency of the product. And hence it is important that we don't take this easy, and then we need to maintain the whole end-to-end supply chain within the required temperature ranges. So this is another statistic which we came across recently, where if you see global biopharmaceutical products, nowadays the requirement and the consumption of the biotechnology products has gone up substantially high. right from 2016 to 22, if you see, the growth in the cold chain requirements is about 53%, whereas non-cold chain is only 26%, and overall it is about 29% growth of the biopharma and the biosimilar products across the globe. So this is data only up to 22, but after that, we still see there is a great upside in the biopharma and cold chain requirements across the globe, which is happening. I come to more, I try to narrow down the scope of the discussion to the Indian pharma market. Of course, I know that there are friends on this line from Saudi and Middle East who would probably also be interested in understanding how the Indian pharma market is structured and how it is behaving within the overall cold chain and overall pharma industry. India is a pretty large country having multiple temperature zones, temperature regions, particularly the mountains at the top, and then the humid territory in the bottom, particularly three sides ocean. Because of that, the temperatures are high and the humidity is also high. And in the map here, if you see, there are few pharma clusters of manufacturing and distribution, which is mostly in the northern and the western region, and all of them are exposed to different temperature conditions. So why I'm putting up this map is basically it is not only that these manufacturing sites are manufacturing the products only for the domestic market, but they are also exporting these products outside India to many countries. So today, after COVID, everyone realizes that India is a very important country in terms of the capacity and the manufacturing facilities we have and distribution to many export markets. India contributes to close to about 25 billion US dollars in terms of exports annually, and domestic market is in fact much larger than that, which is close to about $45 billion, growing at about 11 to 12% year on year. And one of the challenge what we see here is there is a very low penetration of cold chain. When I say cold chain, it is in terms of transportation facilities and storage facilities. On the top of it, e-pharmacies, which is the online pharmacies, is also increasing share year on year. Now, all this put together, if you see, we are in such a critical situation where the exports is increasing, domestic market consumption of pharmaceutical products is increasing. There is a low penetration of cold chain. E-pharmacy demand is going up. Product portfolio is changing from oral solids and tablet capsules to biosimilars and biotechnology products where temperature control is needed. And coupled with that, there is a very little consumer awareness in terms of temperature control. So I think all these factors are pointing towards how we can improve the packaging systems, how we can bring in better packaging systems, which can deliver the product safely to the consumer, whether it is within the domestic market or within, even if it is for exports to a different country. This is a typical pharma supply chain or a map of the distribution network we have in India, where if you see raw materials are supplied to manufacturing locations, where after the raw materials are converted into finished product, then it goes to a DC, then from DC to the wholesalers and distributors, and from there it gets distributed to about 500,000 retailers across the country. And in all this distribution network, if you see three major legs, but one in terms of the raw material supplies to the manufacturing sites. The second one is the transportation to the wholesalers. and the transportation to the distributor, retailers, which we call it as a last mile. Everywhere there is an opportunity, or there is a potential of temperature excursion if we have not shipped the product in the right temperature conditions, if we have not packed the product in the right temperature, right packaging systems as it is desired. Now, if you look at where do we have the visibility, it is very easy to say that we need to put a right packaging or a right transportation mode all the way till the product is delivered to the retailers. But practically, if you look at, manufacturer has got, where do we have controls in terms of visibility and controls? Manufacturer predominantly has the control on the product and as well as the visibility, because they need, the quality department needs to maintain the data for regulatory purposes and compliance purposes. Similarly, in the central warehouse and the C&F locations, or the regional warehouses are predominantly under the control of the manufacturer to set up SOPs, put the controls and checkpoints, and have more visibility. And that is where I feel it is more controllable in nature. But after the regional warehouses in the country, the product goes to the super stockists, then the stockists and the sub stockists, and then before it ends up at the retail store. And this is the area where it is completely in the gray zone, where though the company, the manufacturer put so much of emphasis, there are label claims, the label require the temperature conditions are maintained or mentioned in the label claims, but because of the nature of the business, nature of the transportation, once it is out of the regional distribution point, then it becomes a very difficult area for the controls and visibility of the cold chain. So I think these are the challenges what we are facing in India at this point of time. Of course, while we speak, things have been improving over the day, over the months, with better regulations coming up. But let's see how we can mitigate these challenges through the use of the right packaging systems. I will touch upon a very important topic in terms of how we have evolved over the ages in terms of developing the packaging systems. This is a snapshot of the evolution of the thermal insulation mechanism over the period of the years. Initially, when in the primitive stages, the temperature control or the thermal insulation is predominantly managed by the natural products like straw or fur. And then after that, in the Industrial Revolution, then we migrated to fiberglass and foam, which is predominantly used even today. But we have got much advanced technology today, which is called as vacuum insulation panels. Vacuum insulation, why vacuum insulation is so important, I'll talk about it in the coming slides. But with regard to the technology, this is the highest level of insulation what we can look at in the next many years. So what is vacuum insulation and what is vacuum insulation panel? How does the technology work? If you look at it, is let's start with a very simple device or a container which we see it in our daily life, which is a stainless steel or a thermos flask. How does the thermos flask work? Because there are two layers within the container, and then there is vacuum which is between these two layers, and that is the reason if we put hot things inside this container, it remains hot, and if we put cold things inside it, it remains cold. And because of the vacuum between these two layers, there is no movement of molecules through the vacuum, and hence there is no transfer of thermal energy. That is a very simple concept which was invented in 1904 in Berlin, and then it gave us the knowledge about using this vacuum insulation technology in multiple different ways. And one of the use cases which our company Vacutech took it in 2001 in Würzburg. Würzburg University is very well known across the globe in Germany for winning about 6 Nobel Prizes. And this is one of the technology which we adopted in making thermal insulation products, high performance insulation products, which we call it as vacuum insulation panels. So these vacuum insulation panels are nothing but flat components where we use foam silica to develop these panels, and then an aluminum sheet is used to cover the foam silica, and then we remove air out of these panels to give the real vacuum properties. So how are these vacuum insulation panels better than the conventional products? Basically, these give about 10 times better efficiency than the conventional thermal insulation materials we have it in the market today. So this is just a schematic in terms of representation between the conventional packaging systems, where if you look at this is a conventional packaging system where you have an EPS or a fiberboard or an thermocol box, wherein we use ice gel packets or water gel packets inside this box to maintain the temperatures of the product. And the one on the right side, if you see, this box has been developed using thermal insulation, high performance thermal insulation, which is vacuum insulation panels, and PCM panels. PCM is phase change material, which gives high performance of the refrigeration inside the box. And you can very clearly see how it works in terms of the volume inside the box. The conventional mechanism gives a very little space inside the boxes to maintain the temperatures, and the high performance boxes give you more volume to store the product inside it. So this is a representation. The box what you see on the left side is an EPS box, and on the right side is made out of vacuum insulation panels, and that is the representation. The 10 times performance which gives for the same volume of the product and the same temperature of the product what we need. So apart from the vacuum insulation panels, mostly the packaging systems are categorized into active packaging systems and passive packaging systems. Active packaging systems are the packaging systems which use external energy like dry ice or power or batteries to maintain the temperatures of the product inside the boxes or inside the containers. But whereas passive packaging systems does not need any external energy, they maintain the temperature inside the packaging based on vacuum insulation panel, which is the highest level of thermal insulation available in the world today, and PCM is phase change materials which retain the energy inside the containers, and then they provide longer performance or longer efficiency in terms of maintaining the temperatures inside the packaging. So these are the two broad categories of packaging systems available in the world. And in the last 15-20 years, the technology has been moving towards passive packaging systems. It was Enviro is one of the leader in active packaging systems. They have a history of about 2 to 3 decades, and then over a period of time, if you see, there are many companies, many different technologies which have come up, and in the last 10 years, last decade, most of the packaging systems. They are using passive packaging systems because you don't need any external energy to power the refrigeration system and then keep the temperatures in control. And the technology in terms of developing a passive packaging systems are also improving by the day. Today, or rather in the month of December, actually our company have launched a new packaging system which is based on VIP and PCM. PCM is a phase change material, as I said. This PCM can deliver temperatures up to about minus 63 degrees, which completely avoids a need for dry ice to be used in these packaging systems. Dry ice has an inherent temperature of minus 70 degrees, and because of its harmful nature, pharma and food companies are no more intending to use dry ice, despite it is very cheap. And hence our company came out with this PCM solution, which can deliver a temperature of minus 63 degrees over a period of, which can maintain the temperatures all through the transit. What are there are some what are the factors which we need to consider, particularly choosing the right packaging systems, whether it is active, passive, or whether it is conventional packaging or high performance packaging systems. We need to understand what are the different temperature ranges, particularly by when we want to choose the right packaging system. Basically, the temperature ranges are categorized roughly from plus 25 degrees to about minus 180 degrees. Plus 25 degrees is the normal body temperature, what we call it, which is controlled ambient. Then 2 to 8 degrees is refrigerated. Freezing temperatures are 0 to minus 18 degrees, and minus 70 to minus 80 degrees are called defrozen. And then you have cryogenics, which is minus 80 degrees and below. Now, why this chart is important for us to understand is basically these terminologies are very commonly used: refrigerated or freezing temperatures or controlled ambient temperatures. Based on this, people in the complete supply chain and the whole logistics or distribution network, they need to talk the same language so that they transport and store the products in the right temperatures which is required. So if you look at defrozen, which is minus 70 to minus 80 degrees, that is where the dry ice comes into play. And right from plus 25 degrees up to minus 80 degrees or minus 70 degrees, we have many different technologies which can deliver this performance all through the transit. It is only minus 180 degrees, which is cryogenics, where you need to use liquid nitrogen packed in the cans to deliver this temperature range. But the rest of all the temperature ranges, we can deliver it through PCM and VIP technologies. So this chart shows us in brief what are the different temperature ranges, and then what are the commodities which normally are transported in this temperature ranges. 2 to 8 degrees is where we transport the injectables and vaccines generally. Plus 15 to 25 degrees is the controlled ambient, where you have drug substances and tablets and capsules, which are the oral solids. And 37 degrees are actually, this is minus 37 degrees, my apologies, which is the cell cultures and bacteria. Ambient temperatures are laboratory kits, and then medical devices generally. 0 to minus 18 degrees are the freezing temperatures, which are the biological products. Minus 18 to minus 118 degrees or minus 120 degrees are the biological samples, and the semens and embryos and stem cells, which are being used to transport in the cryogenic containers. So a few more factors apart from the temperatures and the temperatures what we have seen. Basically, transit time of the product. What is the transit time what we are looking at? Is it air mode or ocean mode? Even within the air mode, also whether we have a direct airline connection into a destination, or it has to go through a transit point, which will extend the transit time of the overall logistics, which we consider that we evaluate it as part of the lane risk assessment to decide the right packaging system. Then you have what is the refrigerant volume? Is it an active solution or a passive solution? Based on that, also we decide the right packaging system. And what is the product size? If the product size is only a small sample of about 200 grams or 100 grams or 300 grams, then we choose a different packaging system. Unlike a commercial shipment where you have a whole pallet of the injectables or vaccines to be shipped, then basically we need to look at a different packaging system. So on the right side, if you see, the table gives the different type of packaging systems we have, particularly the vacutainer and vacupal. These are the large containers, large packaging systems, which are used for commercial shipment transportation, and the rest of the small boxes are used for samples and APIs and excipients, which can be shipped in small boxes of about 40 liters or 50 liters or 100 liters, depending upon the requirement of the packaging requirement of the product. And most of these packaging systems are passive packaging systems, which can give or deliver the performance up to about 200 hours. And anywhere to anywhere today, given the improvement in the improvement and availability of the flights, availability of the transportation systems, we can deliver the products within about 200 hours anywhere in the world in the today's situation. In fact, actually, most of these packaging systems have been used to deliver the COVID vaccine across the globe. It is not only in one continent or one country, until unless it is delivered to the last mile and then the last patient to execute these vaccines. And most of these have been proven systems across the globe. So this is a picture which we took during the transportation of the COVID vaccines from Europe into different parts of the world. These are the containers which are advanced passive containers, which does not need any external energy to maintain the temperatures inside the containers. The temperatures we can maintain up to about minus 40 degrees as well. Most of the vaccines have been delivered in 2 to 8 degrees, but there were vaccines like Sputnik and Pfizer, which needed minus 20 degrees temperatures as well to transport them to different parts of the world. I think that comes to the end of my presentation. I hope this was a little enlightening to you, because most of these experiences or most of these packaging systems, we don't see it physically on a day-to-day basis. And I'm sure there might be some more questions in your mind. If I can be any help, that will be my pleasure.
Thank you, Ravi Kumar. Thank you very much. It was a really excellent information to note how the cold chain work. We always hear, but not everybody in supply chain have experience in cold chain. That's definitely, it's a value addition for all of us.
Thank you.
Okay, so yeah, so how does that connect the cold storages in the supply chain? Of course, this is for pharma. Okay, I know you are talking about pharma as an expert. Okay, but what about the cold chain, cold storages and then cold transit? So based on your experience, how does that industry is going on, and what are the key challenges in that industry? Yeah.
Yeah, I think very briefly I touched upon the cold storages also, but in general, if you look at cold storages are stationary and which are much more controllable in nature. Why? Because you have a power connection already given to the cold storage. You have a backup system of generators. You have solar panels attached to the cold storage. So what we feel, particularly in logistics, is the storage part within the cold chain is much more controllable, much more predictable, and there is, you can position alarms in the cold chain, cold storages, which can detect any temperature excursions or any malfunction of the machines or malfunction of the generators, which can alarm the user to take some precautionary steps or immediate alternate steps to retain or bring back the temperatures within the temperature ranges what is needed. But when it is in logistics, particularly, it is outside the warehouse, outside the cold storages, it is definitely much more challenging, because we don't know whether the truck is in the middle of the highway somewhere, or the product is being left on the airport tarmac. By mistake, someone forgot to load it onto the aircraft, or because of some delay, the package has been left on the tarmac for more than 2 hours or 3 hours, which could cause temperature excursions. And hence, in logistics, in transportation, the challenges are much more difficult, much more different. But coming back to your topic, yes, the cold chain industry is growing multifold, both for pharmaceutical and agri products or fresh produce as well in India. And particularly, governments are also giving incentives to set up cold storages and operate them. And recently, even the Prime Minister has also been very vocal in terms of advocating to the industry that the fresh produce, when it is produced, whether it is vegetables or fruits, the value of the fresh produce can increase multifold only when you do some value addition to the product. So when we say value addition, then basically whether it is packaging, whether it is converting into a ready-to-use breakfast or ready-to-use product, then only the value of the product goes multifold, and the farmer can get more benefit and more profits from it, not just selling it as it is. So I think, given that initiative from the government, given that focus from the government also, people are setting up cold storages and giving that access to the farmers in the deep interior regions as well.
Fantastic. Fantastic. Thank you, Ravi Kumar. If you have any questions, we'll just write it to you. Maybe you can answer offline, as it's a long day, and we have Gary Cookins waiting for us. So thank you, Ravi Kumar, for excellent presentation.
Thanks a lot, Mr. Abdul Kader, for you and all the audience as well. I'm happy to be here.